Hi, everyone. So by now, you should have your ARP II draft back to you. If you have any questions about the comments or critiques that I made, please let me know. Hopefully they were clear, but if they weren't, that's completely understandable. Please reach out to me. More than happy to discuss via email or to also set up a time to Zoom with you. This week, let's start talking about your poster presentation and creating your poster. The date down there is from an old PDF, so ignore that 2023. Of course, it's 2025, but the PDF that was created previously by the former lead of this class was so good that I just want to keep using it. Now, during this term, you're going to be doing two things kind of side by side. One of those being to create your poster. The other one is to continue to do revisions for your paper, because ultimately, if you want to try to submit, we want to have it be in as excellent form as possible when you turn things in at the end of the term. So talking about a poster, what makes a good medical poster? Well, what your poster is going to do is it will contribute to medical knowledge. And if you were to take this to a professional conference, this creates an opportunity for you to share that knowledge and spark conversation and potentially inspire people to do future research. So a good medical poster contributes to the medical knowledge, has educational value, or it highlights the need for change in clinical practice or diagnosis or a prognostic approach. So at a typical professional conference, if you've not been to one of these yet, usually you'll have a bunch of poster boards lined up in rows like this, and the poster is affixed to the poster board with thumbtacks or something like that. We'll have a similar setup at the symposium in December. There will be probably two long rows of poster boards set up. Well, actually, yours are not going to be poster boards where you're thumbtacking them onto something. It's going to be more like this easel setup here where you're able to have that hard stock paper versus what we see here on these poster boards. These are typically the I don't know my paper terminology, soft paper that can be rolled up and transported in that way. So looking at the poster design process, you'll include the names of your committee. So you are the first author listed on the title page or in the title page section. And you'll include the members of your team. Frequently, the committee chair would be listed as the last person. Use information from your manuscript to help create the poster, but try not to cut and paste paragraphs into the poster. One thing you want to do is to create conversation. You don't want people just to be reading the whole thing. So this is where you work really hard on trying to present just enough information for somebody to read it, to quickly read it, and to understand the findings, but also to do so in a way that hopefully engages conversation with those that are participating in the symposium. Now, of course, you're going to submit your poster by the deadline for printing, and then you should practice your presentation. So imagine somebody comes to your poster and says, "Hey, tell me about your study." What would you describe to them? How would you describe it to them? How can you do so in a way that is fairly quick, but invites for more conversation? And then, of course, make sure you've got listed on your calendar the presentation day. Now, sections to include on a poster include an introduction. Sometimes people will specifically provide the title introduction, or they may just have a paragraph or two, but don't have that specific title. Other things that people might include, and these can fall in the introduction section themselves, or if you felt necessary, you could have them be headings, some background information, and pertinent elements. These elements, they help the lay audience, so anybody that may not be knowledgeable in your area. Obviously, most people going to a professional symposium have some knowledge about medicine or medical sciences, but they may not have knowledge of your topic. Possibly include a review of the literature, a discussion section, conclusion/future research section, and references. Now, references, as you know, there are potentially a lot of them. I would say you maybe want to only have 5 references at most on your poster. Well, how do you then acknowledge or account for all the references that are part of your scoping review or your systematic review? Some people like to use a QR code, and so you could have a QR code that would take somebody to your entire reference list, or a QR code that takes people to a long reference list, everything that you cited just on your poster. Finally, I wouldn't have acknowledgments. Now, this is, again, sections that were recommended by the prior course instructor. You're going to see some examples from last year's cohort. I think typically having an introduction, a methods or review of the literature section, a table which would present your results, and then a discussion and conclusion section with references or a QR code. Posters should be visual description of your work, need enough details so that your audience can understand the clinical significance of your, not case, but your overall report, and then be succinct with your text. Consider using figures, pictures, and diagrams. Don't consider, you should use. Whenever possible, utilize figures, pictures, and diagrams. Although don't include your Prisma diagram. There's no need for that. Use a good color scheme, which leaves about 40% white space. Don't use a background or graphics that will be too distracting. Also, white text on a dark background is hard to read, and you should only have 3 to 4 columns. The job of an effective poster is to get people's attention and to get them to talk to you. Your title, don't use all caps. There is a template that you can take a look at, but feel free to also, along with the permission of your team, have some creativity. For your authors, again, you're the first author. The last author is usually the chair, but everybody that's been involved in your committee should be listed. Make sure each author gives a final thumbs up. So that's what I'm suggesting there as the obtain permission from all authors. There's an example there at the bottom of how you could lay out the names. General recommendations. The sans serif fonts are better for reading from a distance. Your font size needs to be large enough, large enough is the right way of saying it, so that the individual can be standing 6 feet away and still be able to read your poster. Colors, don't use colors as the background for graphs or figures. Use just a few colors that go together. Multiple colors on a bar graph or a line graph are okay. Otherwise, don't go crazy with the colors. Here's some examples of good and bad charts. And again, with the bad charts, they just have way too many colors. The top one there is also pretty busy with all the overlaps of the numbers. So keep them simple and easy to understand. Remove unnecessary borders, lines, and backgrounds. Highlight colors can be helpful. Remove unnecessary labels and markers. Use solid colors and highlight important values. Pictures, don't include any actual patient pictures. Your pictures should be at least 300 dpi, should be high quality. You don't want them looking grainy, and be careful to stretch pictures, because if you stretch them, you're going to get what we see here, where we've got a natural looking picture in the top and then something that is a little more abnormal down below. Some more on visual information. Looking at the size of stuff, you'll read those large letters first, and you'll read some of the next font size down when skimming a poster. But if you're just skimming, if someone's just skimming, they'll probably not read something that's much smaller, something that's not in a darker color. It's a lot harder to read those. All right, some examples of good and bad posters. This is not a good example. It is very hard to read. What we're seeing here is way too much text. And trying to read against a dark background. Also, there isn't really a good flow. And there's unnecessary figures. Your figures should be meaningful. This one's also considered a bad one. Really overwhelming. As you look at that there, you would probably only stop if the topic was of great interest to you. And even then, it really becomes overwhelming, because do you want to read all of that if you're somebody passing by? And if you do read all of that, does it allow for conversation with the author or authors? This is considered an appropriate example. So we can see the title at the top there, or the fake title. It's centered. We have the author's names and the departments. There is a lot of text, but there also appears to be some meaningful figures that help to break things up. This one here is considered to be a good balance between text and visuals. Now, if you have any questions, always reach out to me or your committee members. Dr. G was the former person that led this series. Again, I'll want to give feedback to you on your poster. Your committee members also need to check off on it too. Poster should be standalone. Again, it's challenging to find that balance between having words and visuals. Visuals can be very helpful, but they should be meaningful. They shouldn't be just something that you found to be funny or something that's kind of cute. There should be a logical flow. Bullets are a good way to break up text. Make sure the alignment of your sections make for a good flow. And then, of course, practice your presentation, as well as thinking about potential questions that people might ask you. Just some final stuff here from the primary or from the other former faculty member. On the day of the poster presentation, they wrote stand to the left of the poster. I don't know that it matters if you stand to the left or to the right. Engage people, smile. If someone shows interest, ask them if they have any questions, offer to walk them through your poster. Try not to point at text, but it's okay to point at figures. And end with any question. All right, some bonus information here. These are from, again, the former director of this course series, but I agree with them too. I think there are some nice little pearls. But this is if you're taking your poster to a professional meeting. First one there, carry your poster at all times. Don't ever check if you're flying it. Now, obviously, that doesn't matter for us because can't fly with our hard stock posters. Obviously, you do want to dress for the session. Wear your most professional dress items. So for men, that's a suit and tie. For women, whatever the equivalent is. I am not an expert on fashion. Of course, be on time, stay the whole session. Other things here, you probably don't need to print out a mini poster for our DMSC symposium. Don't worry about having tacks or push pins. You're not going to need that. If you find that you get dry mouth, you get thirsty easy, bring some water with you. Don't worry about bringing business cards. I don't know that there's going to be a lot of people from outside of the university that are coming. But if you do invite people from outside the university, or if you find out that people from outside the university are coming and you do have some sort of business card, that could be a way to share and network yourself. I don't think you need to bring a notebook and pen with you to write down ideas from your discussions or about any contact information you come across. It's not going to be that type of session, but if you were to go to a professional meeting, there's nothing wrong with that. That's not a bad idea. All right, you'll again find also uploaded this week some examples of posters.